The weight management program is another big part of my practice that I've been doing since the 1980s or so, very long time. Because weight issues are a major issue for many internal medicine problems, like diabetes, hypertension, heart disease, the big three, and some cancers too are related to weight, such as colon cancer and uterine cancer. But obesity puts people at much higher risk for developing those types of cancer. So weight management is a major aspect of my practice, and I try to bring that up even when people come in for physicals.
We have two weight management programs here at Los Cicero Medical Group, and they're both awesome programs. It's centered around appetite suppressant, usually but not always, and nutritional supplementation. So people are on a calorie deficit diet, so we make sure that their vitamins are still, restored by vitamin B12 injections.
It's not about losing weight, because anyone can lose weight. It's about changing a lifestyle and then deciding to be healthier. And with the medical infusion program, we can give the patients vitamins, amino acids, and special minerals that go directly into the bloodstream and then bypassing other areas, for example, the liver and the bowels. And the patients get immediate benefit with those. Especially if they are losing weight and they're starting to get exercise, they get more strength, and they feel good about themselves, in terms of energy.
If you are coming in to see me for the first time, you could expect me to spend a good hour with you. And to start with, I'd pepper you with questions about your lifestyle, and that would include what you typically eat and drink throughout the day, what your medication timing is, what your physical activity is, who do you cook for, who do you eat out with. And then after I get all this information, which takes a while, I then do what's called an assessment, in which case I'll look at what you're doing and report back to you in terms of how did you come out in terms of calories, fat, carbohydrate, whatever area that we're focusing on, and how does it compare to the gold standard. And then lastly, based on that, I'll ask you, what do you think you can achieve here? What do you think is realistic for you to do? And then based on that, I'll come up with a plan just individualized and tailored to you.
A lot of our patients have chronic conditions such as diabetes or hypertension or high cholesterol, and weight loss is an important part of the plan for helping to manage those conditions. And so everything is very integrated. I see the same patients on the internal medicine side as I see on the weight management side. So there's a lot of really good continuity as far as how they're managing their chronic conditions and how we're addressing it with the weight management program.
I have to say I've never been in a team concept, a team environment before until now, and I have to say that it is the way to go, because you get, from the referring providers, you get insights and emphases about a patient that you don't ordinarily get through reading just a chart. So that all translates into better care in the end for the patient. And for example, we have a pharmacist here, and when I have a question about, or I'm unsure about the timing of a specific medication, particularly a diabetic medication, I can just ask her, and then voila, I have my answer. So again, it all rebounds to the patient's advantage.
Because I ballooned up to 327 pounds, and she was with me all the way, trying her best to put me on every possible program that she could put me on. She recommended years ago that I consider having surgery, but I didn't want to do that at the time. But years later, I listened with both ears and started really getting some information about gastric bypass surgery, and with her blessings, I had gastric bypass surgery. But I needed a physician to monitor me and help me through this, and she did all of that. She helped me watch my diet, she helped me choose what I was going to eat and not eat, and she helped make sure that I was responsible in the sense that I knew that each time I came to visit her, if I had put on a pound, I'd have to explain it. And if I was the same weight, I'd have to make sure that that was okay too. But she was never cruel at any time or made me feel uncomfortable at any time. She always treated me so nicely. I came into this knowing a lot. It's just that I wasn't paying attention to what I needed to do. And it wasn't that my heart didn't want to, it was just that I was out of control. And I think that looking back on it now, I really believe that had she not pushed me like she did, and had things not come along like they did, that I may not even be here today. Start the diet route, because she has lots of different types of diets. It's not just one diet for every person. She evaluates the person and deals with that individual, which is what she did with me, because I don't like some things that are so important on some diets. So I would tell them to start that route. And I lost 184 pounds. A whole person, that's right. That's exactly right.